Hello and welcome to Africa Today. I am Esther Mokwariola. Once upon a time in the 1980s, medical researchers made a discovery that shook the world and went on to influence the way life was lived and the way love was made. HIV and AIDS pandemic is now almost in its fourth decade since it was declared a public health concern, with more than 35 million people said to have died from AIDS-related illnesses. And so we ask, what are your thoughts on the fight to eradicate HIV and AIDS in Africa and around the world? You can join the conversation and share your thoughts with us on Twitter at TVC News NG. Well, here's a report in Africa Today. We'll be right back. Welcome.
When foreign nationals are coming into Nigeria, they may be advised to put some condoms in their pockets. That's because Nigeria has the second highest HIV/AIDS burden in the world after South Africa.
I've never done HIV/AIDS tests.
On the streets, not many sexually active Nigerians are interested in knowing their HIV status, a clear pointer to the need for more enlightenment.
Personally, I have doubts as to whether that's HIV as a disease, okay? Because the thing is that HIV is a mystery.
Because as for me, I've never for once make use of rubber. No, I don't believe there's HIV.
Hey, I'm afraid they should not give me injection.
Have you ever done HIV? No. Why?
It's good you know your status early. So if you're HIV positive, you can get drugs, get medications. It's actually not the end of the world like the people say it.
Lagos State's AIDS Control Agency says among the state's 28 million population, 140,000 people are living with HIV, bringing the prevalence rate to 0.5%. The state is running along with the United Nations 2016 Declaration on stemming HIV/AIDS by 2020 and eradicating it by 2030. The chief executive of the AIDS Control Agency says there is a law against stigmatization that the people must be mindful of.
Anybody that stigmatizes any HIV patient is liable to 12 years imprisonment. We are trying to do what we call awareness campaign. So we have a window that we're looking at. In the next 2-3 years, we believe that everybody will have known about it. And so when you do that, you are liable to that 12-year imprisonment.
The government says it is also taking steps to curb mother-to-child transmission by ensuring traditional birth attendants know the HIV status of pregnant mothers before handling them to ensure child safety.
Among the TBA, we have testers, we have counselors and testers. Because if the patient is positive, such patient cannot be handled by them. Their skill is not enough like that. So they need to refer to the primary health care center or a general hospital or a teaching hospital.
World Health Organization statistics say 36 million people are living with the AIDS virus globally. To stay away from being part of that number, sexual fidelity is recommended and the sharing of sharp objects is tagged a no-no. Adolescents are also advised to approach HIV-friendly youth centers for counseling and testing.
Well, before we get into the discussion of the day, let's update you on some top stories around Africa. Global health experts say the Trump administration need to allow United States government health workers return to the northern DRC to help fight the second largest Ebola outbreak in history. UNICEF says children are bearing the brunt of 5 years of fighting in the Central African Republic. Many suffer sexual violence, thousands go hungry, and 1 in 4 have fled their homes. A 19-year-old British man has been arrested in Egypt on suspicion of spying. And now to look at the HIV and AIDS pandemic in Africa as the world celebrates World AIDS Day is Dr. Adesonya Adewale, a gynecologist here in Lagos, Nigeria. And on Skype from South Africa, I have Dr. Ifeanyi Nsofo, Chief Executive, EPI-Africa and Director of Policy and Advocacy at Nigeria Health Watch. Good to have you gentlemen on the program tonight.
It's a pleasure to.
Now let me begin
thank
with
you,
you.
Esther. Thanks
Fine.
for having us here.
Let's begin with you now, Dr. Adesanya. According to the United Nations, now Nigeria has the second largest HIV epidemic in the world and one of the highest rates of new infections in sub-Saharan Africa. You just saw the reports we played before we came on to this. How worrying is this, and especially as Nigerians aren't willing to know their health status?
This is a very disturbing situation. Like you rightly said, HIV is a global pandemic. It's a scourge that has come to stay. And a lot of effort are in place to make sure that we curtail this menace. While all efforts are ongoing, there are several factors that militate against all these efforts that, that is responsible largely for all these statistics that you read out. Right. Some of the barriers are cultural, there are religious barriers, there are issues with economic barrier, there are also issues with respect to acceptance. Most of the time we live in denial in this part of the world. So these are factors that actually, despite all effort, these are factors that are mitigating against success of all these effort.
And so from your own perspective now, Dr. Ifeanyi, how would you assess the level of commitment on the part of health institutions in Africa in dealing with HIV/AIDS related cases and what it can do differently?
Okay, thank you, Esther. I think, again, let's look at, in answering that question, let's look at what the current DG of NACA is doing, Dr. Aliyu. After he came on board, they went around some antenatal clinics to screen women with that came for antenatal, because that's the way, it's through ANC antenatal surveys that usually find out what the prevalence rate for HIV is. And they found out that most of the places where we had on record that HIV cases were high, they couldn't pick up, HIV cases there. And what he has started to do with support of the US government and the federal government and other partners is that Nigeria has started, is currently conducting the National HIV AIDS Indicator and Impact Survey. Because what we want to do is to find out the actual prevalence rate of HIV AIDS in Nigeria. The figure we have is not realistic because, the current figure is that prevalence rate is 3.2%. And about 3.4 million Nigerians are living with HIV/AIDS. However, anecdotal data they have gone to different clinics has shown that doesn't correlate very well. So, and that HIV survey they are doing, the NICE survey, is the largest national survey in any part of the world currently. By the time they are done, we will know exactly what the prevalence rate is in Nigeria. And it has implications for, for treatment, like you said. Because based on the 3.4 million Nigerians living with HIV/AIDS, what we've been told all this while is that it's only 700,000 people that are under treatment. So which means that about 2.7 million people don't have treatment. Yeah, so for us to move forward with treatment in Nigeria across Africa, we have to know the realistic HIV/AIDS prevalence rate. And this is what the new DG of NACA has started with the support of the US government and Nigerian government, WHO and other partners. By the time they are done with that, we'll actually know exactly what it is we're dealing with and begin to mount the right interventions to deal with the pandemic.
All right, let's quickly get more perspectives on this matter. After this break, we're looking at the fight to eradicate HIV and AIDS in Africa and around the world. Welcome back. Every year since 1988, December the 1st is marked World AIDS Day to raise awareness, commitment and double up support for millions of people living with the disease. Know Your Status, which is the theme for this year's commemoration of the World AIDS Day, comes at a time when Nigeria is said to have the second highest burden of HIV in the world, just behind South Africa. So, Dr. Nsofo, let me stay with you now. Let's look at the issue of testing and treatment, which remains one of the challenges hindering the elimination of the pandemic. In Nigeria now, only 15% know their HIV status. What is responsible for this, and how can health institutions ensure total treatment of persons living with HIV in Africa?
Okay, I think the most important factor that militates against Nigerians being tested for HIV/AIDS is the issue of stigma. First of all, self-stigma as an individual, because for most people, once they test positive, they even begin to stigmatize themselves before the community and their families, even get to do that. And the fact that once people know you're HIV positive, you're kind of ostracized, and a lot of people don't want to do that. So because of that, people would rather live in denial. And again, because of the misleading data we have currently as our HIV/AIDS prevalence rate, and you hear that 2.7 million Nigerians that are HIV positive don't have access to treatment, I mean, why would you want to even know your status in the first place? So it's very important for different stakeholders. And in Nigeria, most importantly, because we're a deeply religious country, it's very important for religious institutions to be part of this advocacy. Because HIV/AIDS is not a curse. It's like any chronic disease now. It's like having diabetes, because diabetes cannot be treated, right, but it can be managed, it can be controlled. So a lot of different stakeholders have to be part of this advocacy, so that people will realize that once you test positive, it's a good thing, because then you're going to be placed on treatment, and that if you take your drugs religiously, then you're going to live for as long as you would have lived, even if you did not have HIV/AIDS, testing positive to it. So correct. To me, that's the most important thing, the stigma that goes around. And that's why a lot of people are not signing up to be tested to know their status.
Right. Now, Dr. Adesanya, do you share his sentiments, or you have a contrary view?
Absolutely. There have been a lot of issues with our statistics. Most of the time, you agree with me that even when we want to quote our population, we're always approximating. Even the population of Lagosian that was stated earlier on, I'm sure is an approximation. Even the population of people living in Nigeria today is an approximation. So we've always had issue with the data. I want to comment about on the issue of discrimination. I'm aware that in 2015, President Jonathan actually signed a new anti-discrimination bill into law, where he was protecting the right of people living with HIV, trying to also ensure that those who are working, who are HIV positive, are not, just disengaged, or they don't from work just because they are testing, they are HIV positive. Also, the mandatory testing that before you join my establishment, you must, even against your will. The bill was passed into law in 2015. There are several intricate issues that are actually giving us problem with respect to. If you look at, he also mentioned something about the structural barrier. Right. In 2015 also, I think there were just about 1,078 facilities providing HIV treatment, and according to the national strategic framework that was outlined recently. So there are ongoing efforts to actually meet the target that was set earlier on. The aim of the national aim is to meet about 90%, like talking even from the prevention, strategies, methods, or things to do to prevent HIV infection. There are, just like you heard a guy talk about not even enjoying the use of condom. He had never used it before. So there are efforts to educate and re-educate people of the dual advantage of the use of ordinary condom, how it prevents or protects you against acquiring this disease. So there are a lot of even cultural issues too. Like I mentioned earlier on, it was identified that certain cultural practice predisposes patients to having this HIV infection, like the female genital mutilation. You'll be shocked to know that there are some people that are still, this is my area, you still examine some patients, you find out that they actually had their
private parts.
Private part mutilated. So there are now women also access inheritance. These are things that put females behind. So it makes them quote and unquote vulnerable and highly susceptible to acquiring this infection.
Yeah, talking about the women and children now who happen to be the vulnerable groups in terms of HIV infections. There's this issue of mother-to-child transmission, which still is an issue even today. You know, there had been talks that this thing is, been handled in the health sector, but we still have cases where mother-to-child transmission still is a problem. Why is that?
Well, I would describe the problem like a double monster. I mean, a monster that has multiple angles to it. The truth is that a lot of effort are ongoing. There is a WHO recommended strategy to actually fight this, and I can assure you that most institutions, health institutions, not only in Lagos State, are actually enforcing the practice of there are 4 prongs. There is the one that talked about abstinence, being faithful. If you cannot abstain, try to be faithful. The use of condom. Then identifying your status, testing. Then if you need drugs, there's a general saying that a problem once identified is half solved. If you don't identify a problem, there is no way you can provide a solution to it. So that is a single prong. The second one is, if you look at it, that a woman is pregnant and delivers a baby, and through the bad process, the baby gets infected. If I ask you, if a woman is not pregnant and not delivered any baby, will that baby be infected? So the second prong talks about preventing unwanted pregnancies, trying to make effort that these people try to prevent their pregnancy by, advocating the uptake of contraceptives. That's the second prong. Why the third prong talks about our practice in the health sector as health caregivers. I can assure you that where I practice, we put all this into consideration and we do it to letter. So now, what are the factors that are still making the new cases? Like in 2015, the number of deaths recorded as a result of HIV dropped from 180,000 to I think 150,000. These are as a result, although it's a very marginal reduction, but it's as a result of the effort that are in play. But there are still certain factors that are...
And what are those factors that needs to be considered?
For instance, efforts are in place to coordinate and help all the traditional birth attendants. Right. But a lot of things are going on in there that can predispose patients to having HIV infection.
And talking about the traditional birth attendants, Dr. Adewale, if we're to talk about these things, which is part of our system, do you think the government is doing enough to enlighten the CBA so they understand what it means to helping a mother who probably could be infected with HIV and how to handle it in case of an emergency?
In my own opinion, there's a lot the government is doing. And there are times that they even bring some of them to the established health sector to give them some education, to teach them on how to handle patients, and in order to prevent all of these problems. However, I want to say that there's an issue with the regulatory body managing that sector. There are a lot of, apart from the TBAs, there are quack doctors also perpetrating evil all out there. The regulatory body needs to, increase their effort in terms of managing this kind of problem. It's the major issue we have in that I mean, we're talking about the top one now, because a patient who has not presented in the health institution, who has not presented in hospital, we cannot really
identify
help at the, I mean, at the third level.
Right.
We cannot really manage that situation. So the government need to do more. Yes, they are doing enough. They are doing well, but they need to do more in, I mean, in terms of regulation. What gave birth to most of these traditional birth attendants? I mean, a funny situation. Yeah, something I don't want to
talk about,
delve into.
All right, let's leave that for now. But let's look at this issue pertaining to homosexuality. Dr. Nsofo, now, punitive laws, there are punitive laws against homosexuality in Nigeria especially, which is also another factor to look at, which means, you know, men who have sex with men often face difficulties accessing HIV services. Now, what are your thoughts on this? Do you see such laws being reviewed to sort issues like this, which can affect public health?
Okay, so I mean, we really have to look at those laws, because for me as a public health physician, I'm interested in the health and well-being of my patients. And by the time you have laws that practically drives people who need care on the ground, and also kind of endangers even the health workers that are providing care for, you know, for men that have sex with men. And if you look at the data again, the bulk of our HIV/AIDS infection comes from within men that have sex with men, as well as commercial sex workers. But these are two groups of people that we have stigmatized over the years. We have laws that says if you catch people you get involved in the act, they can be jailed for 14 years. Because of that, they don't come for treatment. And because they don't come for treatment, and because of the stigma that, you know, they face in our country, a number of men who have sex with men are also married. They are married, they have sex with their partners that they are married to, they have sex with their male partners, you know, and before you know it, the infection crosses from one community to the other. Simply because, you know, as a nation, we've just buried our heads in the sand to say that, you know, for different reasons, we don't, you know, we have laws that are, you know, that are punitive against people that live a certain lifestyle. So from a health worker's perspective, we need to change that law. It doesn't make sense. Because for me, I want people to live, you know, to live healthy and very productive lives. So it's not helping people who are intervening in this space. And one other thing I need to talk about as a challenge that is endangering HIV/AIDS intervention in Nigeria is that the government of Nigeria depends heavily on donor funds for HIV/AIDS programming. The American government, through PEPFAR, funds more than 75% of HIV/AIDS treatment in Nigeria. The Global Fund and all the other different organizations. So the government of President Buhari must wake up to say we have to increase domestic resource mobilization for HIV/AIDS programming. Because one day the donors will go. So what happens to people who are living with HIV/AIDS? And this is why, for me, and the work we do at Nigeria Health Watch, advocating for universal health coverage for Nigerians.
Right.
And universal health coverage simply means people having access to the care they need when they need that care without suffering financial hardship. So we must develop plans like through the national health insurance schemes where people can buy health insurance, and part of what it covers is treatment for HIV/AIDS. We have to do this. If we don't do that, then we're really mortgaging our future, as it were. Because one day the donors will go, they won't be here forever. And for a country as rich as Nigeria to still be depending on the international community for donor funds to provide treatment to our citizens, it doesn't make sense. President Buhari must take this as an initiative. And as 2019 election is about to start, Nigerians must begin to ask questions about the plans that the government has for our healthcare.
Right.
We can't keep pushing to the back burners.
Right, Dr. Deole, final thoughts. Final thoughts on this.
He's absolutely right. I mentioned earlier on, I mentioned something about legal barriers.
Right.
This is what he has, extensively itemized, and it's an area that is very sensitive. It's very difficult when you say they are criminals, and they are a group of people that are highly vulnerable. They are highly predisposed to having this infection, spreading it all around, and they need to access care. So it's a very difficult situation. You cannot own up as I am bisexual, and then you need care, and you must access this care from these providers. So it's a very difficult situation. I think they need to look at how to manage that. Maybe there will be some, of course, there are some certain civil society groups that are taking up responsibility in this area.
But much more needs to be done, like you rightly put
Exactly,
earlier on.
exactly.
All right, let's leave it at that. Thank you very much, Dr. Adesonya Adewale, for your thoughts, and also Dr. Ifeanyi Unsofo. Thank you very much for your insights as well on the show.
Thank you, Esther.
Although Africa and the world have made progress on tackling HIV and AIDS, the journey is still far from over, with the need to increase funding, implement policies, and improve on research to end the pandemic once and for all. Well, as the world takes another time out to remember the dead and support the living, commitment towards eliminating the disease must be renewed, knowing that an HIV and AIDS-free generation remains within reach. And that is our package for tonight. But don't forget to join the conversation as usual on Twitter at TVC News NG, and also follow me for updates around Africa at Esther TVC News. Until the next one again, I am Esther Omopariola, and always remember, Africa can only get better.